The physiology of lungs is so fascinating in terms of how it reacts to the outside environment, how it kind of compensates for the stresses put upon them, which is unmatched in any other organ systems. Pulmonary critical care is my specialty, which essentially means pulmonary is taking care of patients with lung and problems related to the lung. And then critical care is the part which is the intensive care unit, which is usually the sickest patients in the hospital getting admitted to the ICU or the intensive care unit. In the outpatient setting would be the pulmonary patients. Usual pulmonary patients are day-to-day bread and butter involves patients with chronic obstructive pulmonary disease, which is COPD. These are the folks who have emphysema, chronic bronchitis. In addition to that, we see patients with asthma, adult patients with asthma, chronic allergies as well related to asthma. Interstitial lung disease such as pulmonary fibrosis, which is a fancy word for scarring of the lungs. Could be idiopathic, could be related to some connective tissue disorders, could be related to some autoimmune disorders. We treat sleep apnea as well, obstructive and central sleep apnea. Usually our first visit involves asking a lot of questions about patients' history because 9 out of 10 times our answer is hidden in the history. Common questions we ask is what are their common symptoms, which includes shortness of breath, cough, whether they are producing sputum or it's a dry cough, wheezing, chest pain, chest tightness, and specifically when you talk about sleep apnea, we will ask about sleep disorders such as not able to fall asleep or falling asleep and waking up multiple times a night, feeling tired throughout the day, feeling exhausted, low energy. Diagnosis of lung cancer is a big part of what I do. There is a special procedure called EBUS bronchoscopy to diagnose the lymph nodes, which is the modern day of diagnosing most or majority of the lung cancers. Other things which come up is pulmonary hypertension, which is essentially higher pressures on the right side of the heart. Also oxygen supplementation, folks who have issues in terms of low oxygen, high carbon dioxide, which is typically not what we want. We want low carbon dioxide and high oxygen. Patients know me personally. They know about my interests. I know about their interests, their travel plans, their families and sense of their kids, which I find rewarding, and I feel honored to be involved in their care. My favorite thing to do is in Northeast Ohio, we're blessed to have metro parks, so biking is my favorite thing to do.